Welcome to Pennsylvania in Focus. I'm Kristen Smith. This week, the state is considering banning non-compete agreements for healthcare workers. This is an issue that has restricted where doctors and nurses can work, which is a big hindrance to Pennsylvania's need to grow its healthcare network. So, Anthony, tell us a little bit more about this legislation.
Yeah, so Pennsylvania is one of a dozen states nationally that don't have any restrictions on non-compete agreements. When you look nationally, there's a number of different stages here. We're looking at states like California, North Dakota, Minnesota, and Oklahoma fully ban non-competes in healthcare. Some others like Colorado, Virginia, Maryland, and a few others restricted below certain income limits, but each state kind of sets this differently. The proposal, House Bill 1633 from Dan Frankel out in the Pittsburgh area, would make these non-competes void and unenforceable for anyone authorized to practice in healthcare. So we're talking doctors, nurses, basically anyone who's gone through a licensing agreement here. Frankel argued, it's important in terms of improving or maintaining access for individuals to healthcare, reducing healthcare costs, and a general sense of fairness to both providers and patients. Because what we've seen in the past, especially if you're out around Pittsburgh or maybe around Philadelphia, you may end up with doctors who have to sign a non-compete, and then when they leave, they can't work in state. So then they'll work down in West Virginia or Ohio or New Jersey, New York. A lot of Pennsylvania areas border states and other populations, so they can just kind of leave. And so the idea here is if you get rid of these non-competes, then you're not losing as many nurses or doctors, and they're able to actually practice rather than sit on their hands for a few years or have to go out of state to get a job.
So would this bill apply to all 67 counties?
So generally it would. There's some exceptions here. So you would need three things to hold for a non-compete not to apply. You would need to be in a 6th, 7th, or 8th class county, which is about 34 counties in the state of lower population. The geographic restriction would have to be less than 45 miles, and the non-compete would have to be in effect for 2 years or less. So even if this bill does go through, not all non-competes would blank out. There would be some exceptions of, if you're working in a very low population county, you may still be held to one. But if this would go through and it's already passed in the House, employers would also have to notify their patients of if their doctor or their nurse leaves. It would have to let them know how they could continue treatment under them or contact them to switch to that new provider.
Pennsylvania isn't a leader in this idea, are they?
No, I mean, this is like most other things in Pennsylvania. We generally follow trends rather than set one. So, again, as we've talked about, a handful of states have already banned non-competes completely. Another dozen states or so have at least added some restrictions to where non-competes can come into place. This is also coming in the background of nationally, the Federal Trade Commission is trying to ban non-competes. And so, there's some legal challenges to that and whether it will hold up. But, we've seen in states like California also bans this in, their tech sector, which is one of the reasons why Silicon Valley kind of took off out there. It's this idea of trying to balance, companies investing in workers and making sure that workers, get as much training as they can, but also balancing the interest of making sure the consumer or the patient has real choice and workers themselves are not restrained from working in a, generally pro-social or pro-market way.
Anthony, thanks for joining us today. Listeners can keep up with this story and more at thecentersquare.com.
Freedom, individualism, limited government. On these issues, conservatives and libertarians generally agree. But where do we disagree? Check out the Future of Freedom podcast for civil, reasoned conversations about some of today's most pressing topics. It's not a debate. Our goal is to provide the best arguments from either side of an issue. Then you decide. It's the Future of Freedom podcast. Find it at americastalking.com or wherever you find your podcasts.